hours. So I decided to go to school.
And it's my pleasure to be able to introduce a really illustrious, particularly disruptive panel this morning.
Hi, I'm Franny Van, the publisher of The Hill. I think you all have copies on your chair. And if you want some to your office, you should just call me. I'll make sure you get them at your offices as well. Or you can go to thehill.com. Honored to be a disruptive woman. What Robin has put together is certainly a pearl. It's such important women's health issues and a contribution to public policy.
So I'm Indu Subaiya, and we were so excited to do our first Health 2.0 conference in DC. It's a series that we started in 2007 that came out of San Francisco, and we've had a chance to bring the sort of innovations that women like the women to my right have come up with to the larger public, and to showcase live technology demonstrations and create a forum for an exchange of ideas. So Health 2.0 started as sort of a discussion, a series of activities, and possibly now one we think of as a movement, but people began to say, what would happen if you applied the same social software, lightweight tools that allowed for collaboration? The first stage of Health 2.0, this is really what we call the sort of user-generated stage of Health 2.0. All of us in this room have gone online and searched for something in health, the answer to a healthcare question by going into Google. And search, that simple act of using the internet to find information about your health, is kind of where Health 2.0 started. It gave consumers incredible access to information that may have otherwise only been available through their doctor, through encyclopedias, what have you. And then we may have heard of companies like Health Grades, which lets you find information about a doctor, find out where they were credentialed, other information about them to choose the best doctor. And another tool called Destination RX that demoed yesterday, they allow you to choose a health plan based on your particular requirements. These types of tools gave consumers incredible transparency and choice into the healthcare system, and coupled with the tools letting you talk to your doctor online, you actually begin to see that healthcare and the way it's delivered can actually be changed.
The Health 2.0 conference was wonderful, and it was very different than other Health 2.0 conferences because we were talking more about policy. These Health 2.0 companies, I think, has been the most interesting piece of this, and still I think we're all struggling with business models and how do you make money, because most of the companies in our space make money through the pharmaceutical industry. And there are no other really viable, there are very few viable payment options right now. So paying directly for alternative funding for healthcare services is going to be an important issue.
We actually started off knowing that our platform was going to be available to consumers and professionals. But we started with consumers because the general belief 4 years ago, and it was true, was the doctors were not interested in technology. So we can continue to offer our products for free to consumers and expect to be reimbursed by the healthcare system. So that, to me, was a big, exciting takeaway.
That's a great point. And Alex?
So I'm with Eliza, and we actually have been around for 10 years, or possibly old, and have done, believe it or not, over 400 million interactions in the healthcare space. It's the type of outreach that Eliza does. We actually reach out in people's homes. We use automated phone calls primarily, but also email and text and mail. And we interact with people in a very, very data-driven way. And we get instantaneous feedback about how our outreach is being received. And when you live that way in that world, you get very humbled because you're very aware of how disinterested most of the population is in the traditional type of healthcare information that we as an industry are offering. We have all the technology today to solve all the problems of health across the world. It's not a lack of technology, it's a lack of us understanding in many different ways how to actually apply the technology that exists. And I thought that came out loud and clear yesterday.
One of the biggest problems in healthcare is that there's a lot of information, but none of it has been digitized, none of it's computerized, and it's only very recently that we're thinking more about having computerized systems. And kudos to the Obama administration for focusing on that. It's probably one of the most important things we can do in healthcare. Once information is computerized on the systems, then we can follow what happens to people with different treatments and figure out what's helpful and what's not. We've developed software that reads free text, medical information. We translate it into common language so it's understandable to patients and to consumers. And we use that underlying technology to make information available to people when they need it, given their particular clinical circumstances.
Marlene's technology is, I think, really critical to bridge the gap where we have workflow issues around how these technologies work today, and even with being used to finding them, we still have to really figure out the right workflow to use EMRs. So this technology allows physicians to be able to actually be a little bit more free-form in how they might use some of these systems, and then be a translator to get that information into digitized, database-full format to actually be analyzed in the way that Marlene talked about. So just to put in context, what high-tech and ONC is doing right now.
We are partners with Marlene's company, and I think of us as right brain, left brain, right brain. So she does the natural language. We do incredible analytics with the same sort of thing. We both have, and we're unique in the industry, that we are focused on the entire regimen of drugs that somebody is taking. The cost of adverse drug side effects is enormous. It's estimated to be between 177 and $300 billion a year. For every dollar we spend on drugs, we spend $1.25 to manage their side effects. The death toll is around 4,000 a week in the US alone. You can actually go in and search for the side effects or conditions or symptoms you're feeling and ask the same question you can in Marlene's, but get a visual answer this time. And it will tell you what is the likelihood that the side effect, that the feeling that you're having is really a side effect of the symptom. So that's, in a nutshell, what we do.
Surveyor Health gives one example of the complexity of what really goes on in medication safety specifically, and the importance of realizing also that the consumer potentially has a role here, and that's why Surveyor Health has both a consumer view and a provider view.
It's one thing to say the consumer is more responsible, but without the tools to be more responsible and take control, that's sort of putting unfair responsibility. I think we're seeing now actual tools and capabilities that if I am going to sort of take more charge, I think the phrase being CEO of my own health came up several times by several panelists. Well, I need tools to do that, and these are some powerful examples.
And what a lot of technology is doing, and this is what we think about every single day, is letting folks know that they're not alone, that they are empowered, that they know themselves better than somebody else, and giving them both the information but also the inspiration to act on behalf of themselves and on behalf of their families. And that's critical.
It's taking these tools, but it's putting it into a real context. It's putting it into what patients can do, what caregivers could do. People are much more comfortable going online and getting and searching for information. Doesn't mean that everybody has a broadband connection, doesn't mean that everybody is computer literate, but these are tools that are being developed for everybody. Thank you for coming, really appreciate your being here, and our next breakfast won't be till September, we're taking the summer off. But enjoy, thanks again. Thank you.